Yeah. Good evening, everybody. I am so excited. I'm working on staying calm, cool, collected, and not geek out a little bit. I'm so excited that Dr. Katura Bullock is joining us. I'm so happy because this is something like I've wanted to do with her for a little while. And I think timing couldn't have been better because all of you are going through residency interviews right now. Welcome to the Resi Prep Live, Dr. Bullock. Thank you so much for joining us. How are you?
I am doing great. Thank you so much for the invitation. I'm happy to be here.
Thank you for accepting. I was like really thrilled you agreed to join us. And it's totally accidental. We didn't coordinate at all that we're matching. We
Great
didn't
mind.
coordinate. We didn't coordinate this at all that we're matching. But I am it looks cute. It looks cute on my end that like we're matching today.
Definitely. Definitely.
Welcome. If you're joining us live, please let us know in the comment that you can hear us well, and that we are coming through for you. There's going to be a lot of information getting shared in addition to just introducing you guys and having those of you who haven't had the pleasure yet of interacting with Dr. Bullock to get to meet her today. So if you can hear us or cannot hear us, let us know and then we'll work on trying to fix that for you. Welcome. This is the Resi Prep Live, Streamline, and Podcast. I am joined today by Dr. Bullock, the founder of PharmDtoBe and editor in chief. I'm not going to get into too much about her because I do want you guys to hear directly from her. Um, my focus at Resi Prep is really just helping you guys turn the plethora of information that's out there available about residency and residency prep into pragmatic approaches so that you can maximize your chances of success as interview seasons unfolding. And so I am hoping to bring you a lot of really insightful conversations with people who've been at this a lot longer than me to offer all of us some insight on how we can all be successful. With that, Dr. Bullock, can you please tell us a little bit about yourself?
Absolutely. So my name is Katura Bullock, and as Sally mentioned, I am the owner and editor in chief of PharmDtoBe Guides. So we've been up and running. Oh gosh, it's been a little bit over a year now. Time goes quickly.
Yay!
Um, and so, what I've been working on is producing essentially study guides
Mhm.
of strictly focusing on pharmacy students. So, I've worked in a lot of different areas of pharmacy, and I've
Yeah.
been faculty in the past. And through that experience, one of the things that I noticed is that pharmacy students, much like other students, are really great at kind of memorizing facts. We could tell you the half-life of furosemide. They're so excited to tell you that. But then when it comes down to applying that information to a patient, which is what we really want our
Yeah.
students to be able to do, sometimes there's a gap, and that's through no fault of their
Mhm.
own, the students, but
Yeah.
it's just because patients are complex,
Yeah.
they're ambiguous, they're
Mhm.
complicated, they
Mhm.
have the audacity to have more than one comorbidity at a time.
Literally.
So it's hard to balance all this information. And
Yeah.
so, what I really wanted to be able to do was to assist students as they navigate,
Yeah.
um, like I said, moving from that very factual information that's often presented in the textbooks to
Yeah.
how do I make that relevant to the patients that I am
Mhm.
seeing on my rotations,
Yeah.
on my exams,
Mhm.
and in clinical practice. So, what we have available is we have pharmacotherapy study guides. So if you think about your common disease states, we've got GI, we've got renal, we've got cardiology. We also have your fundamentals. So we have information on calculations. That's by far our
Yeah.
most popular products is the
Yeah.
calculations.
Yeah.
Um, and we also have kind of things like kinetics, things like medchem, things
Yeah.
like pharmacology. So we really try to cover the basis of
Yeah.
what your pharmacy student would see across the curriculum.
Mhm.
Um, and they're all available as digital products. We
Mm.
really strive to make sure they're reasonable priced so that
Yeah.
they are accessible.
Yeah.
So check out our website. We're also available on Etsy, and
Yeah.
we are kind of also available on multiple social media platforms. We're on LinkedIn, we're on Instagram,
Yeah.
because we really want to be able to present kind of bite-sized information, again, that a student can apply to a patient.
Absolutely. And that's why we needed her here. And that's why we needed her here today. Because that gap, that's that scary gap. Like if you ask many student pharmacists, the download and regurgitate information, they are ready. Like they're ready to go. But these residency interview clinical challenge, it's about how do you apply these fundamentals to solving a patient problem? So I think I wanted to start with that one first, and your take or advice on how would a prospective candidate that is currently in the trenches, how should they go about preparing themselves with how to approach solving patient problems using knowledge they already have?
I think it's really important for kind of your prospective residency candidates to know that, to recognize and honor that they have a great deal of knowledge.
Yeah.
Sometimes when you are applying for residency, you focus on the things that you don't know. But
Yeah.
trust me, as a
Yeah.
fourth year pharmacy student, you know so much.
Much.
And so, a few things to remember is that one, the recognize the purpose of the clinical case
Yeah.
when you get that on a residency interview. It
Mhm.
is not to kind of analyze every piece of drug therapy knowledge that you have. Like,
Yeah.
this is not the time. Those residency faculty members
Yeah.
and the people who will be in the room during the interview, they are not truly wanting to know if you know every dose of losartan.
Right.
They intent is not to know if you can regurgitate and spit out all of the gram negative coverage of levothyroxine. Like, that is truly not their goal.
Yeah.
They do want to know if you have a strong drug therapy knowledge base, but it's really not about the details. So I
Yeah.
think being mindful of
Mhm.
the fact that the students really have a good amount of practice every day. When you are going to APPEs, you
Yeah.
are practicing using this knowledge. So
Mhm.
just tap into, know that, like, remember your confidence, like, and be confident
Yeah.
in the knowledge that you have. I think if you truly feel that you want to prepare, which I understand, you just need someone to
Yeah.
recognize that the the odds are that you will see a common core disease state. You are
Mhm.
going to see things like diabetes, hypertension, pneumonia, heart failure.
Mhm.
That those are the disease states that you are going to see during a clinical case.
Mm.
It is not, you're not going to see viral meningitis. You are not going to see, like, I don't know, like glioblastoma. Like, that's, those are
Yeah. Right. It's not gonna be an obscure disease state where you're like, "What was that again?"
So, if you truly, as a student, feel the need to prepare, think about, like, the common disease
Yeah.
states, and again, be confident in the fact that you truly have the prerequisite knowledge that
Yeah.
the kind of residency faculty and preceptors want
Mhm.
to evaluate.
Yeah.
So truly, it is about how can you present a patient case. So
Yeah.
really, it's about the thought process,
Yeah.
your clinical reasoning, and
Mhm.
being able to present that out loud,
Yeah.
more, again, more than the detailed drug knowledge. So think
Mhm.
about what information would you look for if you're given a patient history? What would you look for in the subjective and objective?
Mhm.
Um, what clarifying questions would you ask if
Mhm.
there's missing information?
Yeah.
Um, so those are the things that's more about the process and your reasoning than the kind of specific detailed information, a
Yeah.
process that you can apply to kind of any case, as
Mhm.
opposed to, again, like what is the preferred first line therapy for hypertension, if that makes sense.
Right. It makes perfect sense. And I think you touched on something that I try to tell students, but I don't think I explained it quite as well. So it's one thing for your ability to think through the problem and even be further ahead and developing that plan. But how do you present and articulate that in a manner where you are truly conveying that I have good command or I have mastery of what this process, this disease state, and these medication therapy problem is about. And I hope you guys are like hearing, I hope you're hearing Dr. Bullock, like when she talks to you about your confidence and really holding on to the stuff that you already have. Like working on developing that further is never going to be a bad idea, but I think like that uncertainty. And I wanted to ask you, like, from a faculty standpoint, what are some strategies do you think that you've employed yourself in working with students or that you've seen work over the years in helping them really overcome this one piece? Because it's so much more about how they feel about it than when they actually go through it. They're like, oh, that wasn't that bad.
It wasn't so bad. Yes.
Yeah.
I would say often it is the imagined, we tend to imagine that it's much worse than the
Yeah.
reality.
Facts.
I don't know. That seems to be just a human condition.
Yeah.
I
Yeah.
say with my patients, when I'm counseling them for insulin, they'll be shaking. They're so afraid of the needle. And
Needle.
after we practice, it's like they say, oh, it wasn't so bad.
Aw.
Um, I think first practice,
Yeah.
practice, practice. So, I think the more times you can get yourself in that situation, even if it is simulated,
Yeah.
you can build up that confidence. So you can kind of tell yourself, I'm capable, I am confident. So practice. I do feel like find out, what is positive for you. So some people find that affirmations are
Yeah.
helpful. Some
Yeah.
people feel like they're, feel quite silly with the if you feel like that is helpful for you, then by all means shout them from the rooftop so that you feel that you are confident. I also think that just honor where you are in your professional journey. The
Yeah.
entire reason that you are doing a residency is to continue learning.
Yeah.
So, um, um, as hard as
Mhm.
it is unfair to yourself
Yeah.
to compare yourself as a student to your preceptor
Mhm.
or
Yeah.
even to a resident. You
Yeah.
know, they are just naturally, they have more experience and
Mhm.
by extension, more knowledge than
Yeah.
you.
Yeah.
And you, as a fourth year, have more experience and more knowledge than a first year. So just honor
Absolutely.
where you are in your journey, and just recognize, so that comparison is
Yeah.
what makes it difficult, and it will be the enemy of your confidence. So
Yeah.
always comparing yourself to people who are ahead,
Good.
that will help, that will eat away at your confidence.
Yeah.
Just recognize that you have come so far,
Far.
instead of comparing yourself to those who are ahead of you, compare yourself to where you were even a year ago, and
Uh-huh.
be grateful for all that you have learned. Okay.
Yeah. Oh my God, this is so good. I'm gaining from this. I'm gaining from that advice and where I was a year ago and where I am now.
Absolutely.
So much growth to celebrate in just within a
Absolutely.
year. And I don't know that I take that time personally to reflect and appreciate how far I've come. Thank you for that, Jem. So, some of the other questions that many students tend to ask me is, how comfortable should they be if their clinical case is missing something? So they've read the case, they really do feel like they have a good grasp on where the case is headed, but they think that they're missing a piece of information. Do you have any advice on how they could go about bringing that up, or even teasing that out to the person who's proctoring this process for them?
Yeah, I think this is a very common situation.
Yeah.
I certainly can't put myself in the place of every single interview, but I do think it's a very common scenario for there to be kind of gaps in the case.
Yeah.
And part of that is, again, because when you are in practice, it would be great if your patients kind of presented every piece of information in a very clear, logical order for you to evaluate, but that's just not the reality. So you do
Yeah.
often have to ask those clarifying questions or know where to go to
Yeah.
get that information. So I do think it's very common for during a clinical case for there to be missing information so that again the faculty or the preceptors can evaluate if you are able, one, to identify those
Mhm.
gaps, and then two, to be comfortable knowing how to identify your resources. So what you do not need to know, again, is every piece of information, but knowing how to use the best resources. So
Yeah.
being comfortable saying, I would refer to XYZ guideline. Um,
Mhm.
Even if you don't know the specific guidelines. So even if you don't know that this case is about diabetes and maybe the best place to go is the ADA guidelines, just
Mhm.
to know that it would be appropriate to refer to kind of a current evidence-based guideline.
Guideline. Yeah.
So that's often better
Yeah.
than it's always better to refer to a resource than to make up an incorrect, answer.
Yeah.
Always always better to refer to a resource than to make up an incorrect answer. Or
That's
something
it.
I've seen that's generally not great is like to reference a school professor or something you've heard personally because they won't be there during your residency.
No.
So
No.
so something that is widely available. So Micromedics, Lexicomp, a guideline,
Yes.
something that everyone can access. Again, because this is about reasoning, you using clinical skills. That's a skill. Using evidence-based medicine is a skill, so that's something that is able that your residency program wants to be able to evaluate if you have that skill.
Absolutely. Like knowing your limits.
Yes,
Knowing
yes,
your limits. Like, I know
absolutely.
this, I know this, I know this. Like,
I
I'm
don't
not
know
sure about this one.
exactly.
Let me
Absolutely.
call a friend. I'm not sure about this one. Like, where would you go?
Yes.
One of the other questions that I got sent to me directly was, what is your advice about guessing? If I have a case in front of me and I've read the case, I think I understand the case, I know the answer, but perhaps the question in front of me now is dosing, and I am not certain about the dosing. Can I guess the dosing? Or should I say that I'm not sure about this dose, but here is where I would go to find it? What is your advice on those two approaches?
Oh, I would hands down say I'm not sure
Yeah.
about this is where I would go. Or I would something along the lines of, this is, my best guess or this is what I believe is correct, but I would reference this to verify. Something that
Yeah.
says I'm making my best educated guess,
Uh-huh.
but because I am not sure, I would reference this or I would check here
Yeah.
because you are not supposed to be the expert yet.
No.
Again, honoring where you are in your journey. Again,
Mhm.
the preceptors and the faculty, they respect that
Mhm.
you are a student and you are still a learner. There is absolutely nothing wrong with still being a learner. So it is
Mhm.
perfectly fine and respectable and reasonable to say, this is what I think, this is what I believe, but
Mhm.
here is where, trust but verify. Here's
Yes, that's
right
literally my slogan.
what I believe, but here's because I've been practicing 15 years now, but
Oh my gosh.
I still
That's
do that for it would be dangerous for my patients if I just entered doses blindly and never checked.
yeah.
So I would never expect a student to do that.
Mhm.
Never.
Yeah, absolutely. Oh gosh, trust but verify. And I always have to tell the students like on day one, it's not you, it's me. I practice with a low little key, a little key touch of paranoia. And that the way I put that to rest, yeah, the way I put that to rest is by making sure that I always take the time to verify. So don't
Yes.
feel any way about it if I'm checking your work thoroughly. It's just I live by trust and verify. That's I just thought it was so funny that you literally said that because all of my coworkers like they literally make fun of me about that. One of the other questions that were asked was more particular. Actually, they wanted to learn about you. And I think you've touched on it a little bit, but they were curious what inspired you to start PharmD guides?
I truly, it was the awareness of the complexity of pharmacy.
Mhm.
I have seen from students, both while I was faculty and I'm quite involved in precepting, that there is a comfort in the memorization of facts.
Yeah.
I am a professional flashcard maker. I will make you some beautiful flashcards. But often it's hard to kind of move from those flashcards to you said, oh wow, this patient is taking 20 meds and they have 15 disease states, and what do I do with all of this
Yeah.
information?
Mhm.
And so there's a transition that often has to occur that can be challenging. That can be
Yeah.
getting. I always used to tell students, get comfortable with that gray.
Yeah.
What do I do when there's three correct answers and I'm not sure. I don't
Yeah.
know that. What do I do with that? And really helping to move through that process, and how do I develop those skills when
Yeah.
I have to rely on me, and again being confident that I know how to make a good therapeutic decision.
Yeah. And I think I have to say, like, I was definitely one of those students. Like, when I was asked on residency interviews why, I talked about that gap quite a bit. Like, the exams has one right answer. It's not, like select all that apply. I know that the right things are going to stand out to me, but the idea that that was or the expectation, it really was an expectation. I didn't expect that all of these exams that I took weren't going to translate seamlessly into like patient care.
Yes.
And so I remember my first block just feeling like I got knocked off my feet because it was an adjustment, and it really really was an adjustment. So like people interviewing now, it's what I try to tell them. You just like it's a process and you've only had 6 months of it. Like there's this second 6 months coming. The expectations increase when you get into residency, but overall, I love this the saying you just had about appreciating where you are in your journey, because
Absolutely.
I think they get mesmerized. Like they want to be able to just be called upon and do it. And I'm like, I get that question like 3 times every day. I don't have to look it up anymore because it's so common, but
Yes.
it's week 1 for you. It's completely
Absolutely.
normal.
Yes. Yes.
Any last minute advice for them on how to tackle this? Because I don't know. I feel like you've covered like the major fundamentals of how they do this, or how anyone would go through this and maximize their chances of success. Are there any other nuggets that we didn't talk about?
I think the one thing I would say is, again, most students, or I'll speak for myself. I'll speak for myself. I can remember my, residency interview
Yeah.
process, and um, I might be known as a bit of a nervous Nelly, just a touch, just a touch. And I'm one of those people that the more you tell me to calm down, like, ah.
I know
so,
it a little too well, unfortunately.
so I will say, I will preface this with do what I say, not as I do. But we talk a lot about preparing and how you can prepare, but I truly, especially the night before, it is so much better to get a good night's sleep. It's so much better to get a good night's sleep and then show up at
Absolutely.
your interview like well rested
Yeah.
with, good energy, enthusiasm,
Yeah.
focus. Please, please, please do not be staying up the night before trying to learn that one last dose or memorize another piece of the guideline. Please don't do it. Again, I can tell you this because I was that person. Okay, please don't. Please don't. They will not ask you the question you think you're getting ready
Right.
for. So go
No.
to bed, get some rest. You know, it's so
Yeah.
much better to be well rested and have a good energy, enthusiasm, and focus than to feel like you need to, still be preparing at the last minute. So
Yeah.
that's what I would say. Go
Thank
ahead.
you. Thank you so much. I'm gonna pretend like I can't identify with the nervous Nelly thing, but I identify with it way too much, like much more than I care to admit. But I
Yeah.
know what it is to just be. It's just that one little chapter, and if I can finish
One
that,
last
yeah.
thing. One last
And
thing.
then hours later, one chapter is 5, and you're still sitting up. So
Yeah.
please just listen to Dr. Bullock. Don't do that.
Yes.
That
Learn
doesn't work.
from my mistakes.
Yeah. How can they find you? How can they find PharmD to be guides? Those that want to engage with you more, where can they find you?
So, PharmDtoBe Guides is on LinkedIn. We are on Instagram. Both of those, our handle is at PharmD2B Guides. I love, love, love hearing from students. It's been great. That's definitely been a bonus, is kind of reaching
Yeah.
out to students and helping them through their journey, even just being able to be a positive like voice encouragement, because
Yeah.
I know that I benefited so greatly
Oh,
from
absolutely.
mentors, and I try very hard to mentor all kind of who come across my path. So feel
Yeah.
free. My email, if you stop by my page, my email will be on there. Do not be shy. Send me a message. I try very hard to respond within 24 hours. Give me some grace if it's the weekend, but I do to respond
Yeah.
as soon as I can. I would really truly love to hear from you.
Oh, guys, please take her up on it. I can tell you from personal experience, it's always so pleasant. It's always nice to speak with you. And again, I'm so grateful for this opportunity. I want the students to hear from everyone and the different perspective, not just from me. I appreciate you coming on and sharing your wisdom and your expertise and the positive energy you always have. Like I feel like they they all need that right about now. Thank you so much, Dr. Bullock. Everybody, thank you for joining us live. If you're watching this on replay, thank you for watching. Let your friends know how to find Dr. Bullock, the PharmD guides. There's an Etsy boutique, but also don't hesitate to reach out to her. Um, Trust me, you won't regret it. Thank you, everybody, and have a wonderful evening. Thank you. We'll see you guys later.